Good day, viewers. Today we've got a patient that's complaining of a pain across her sacral area here, and it occurred after she had fallen and fallen so hard that she'd broken her hip. She's had a hip replacement done on the left hand side as well as on the right hand side, but since then she's felt off balance to a point where she's struggling to walk and she literally cannot stand on this leg. So we've already done some mobilizations and that, and the leg is already better, but I wanted to discuss with you what's going on. So if she bends forward, what I'm going to do is I'm going to put my fingers on the SI joint. She's going to bend forward for me, but for my foot into. And what you'll see is the right SI joint is going up and the left SI joint is not moving at all. So come back up again. And then you can see it going back into position, which is indicative that the left side is not moving. Now if I ask her to bend her right leg up to 90 degrees in front of her, she struggles and she's also twisting her whole body up, which is indicative that she cannot hold that position because the SI joint is not working. You're going to do the same on the other side, lift the other leg up. Here, her balance is shocking generally, so we need to work on that. But if you can lift the left leg up again for me, she's getting a dip down, which is indicative that she's got weakness of the butt from the right side's total hip replacement. So we've got two problems going on here. Weakness of the bum because she's getting a Trendelenburg tilt. So pick up that left leg again. I want them to see the Trendelenburg. You see it's tipping up to the side. She hasn't got butt stability there, so we need to strengthen the butt up. And then if she lifts up the right leg up, she can't hold it and she's getting a twist there because the SI joint is not working. So come lie on your back for me, please, Ola. Ja, met die hand op jou rug. Ja, kop op. So what we're going to do here is we are now going to mobilize the SI joint. So basically, bene vir my op. Daar kry ek die knee. And we are going to lift the knee up, and we are just going to gently push the knee down into the hip, down into the back. And this is how you mobilize the SI joint at the back. And when I started doing this, we actually got a bit of a click in the SI joint earlier, which made her then able to lift the leg a little bit better than what she was doing. So we're going to first do that, and then we do it in differing degrees of angles to loosen up the SI joint at the back. And she will always let us know if she feels the click again, loosening the SI joint. The second exercise that we are going to do, and this is an exercise that they then do at home as homework. You start off with a wide area, and they would sit over the edge of the bed and put their own arm between their legs. And then they've got to push the arms together as hard as possible, counting for 5 counts, and then they relax again, and you repeat it 3 times. So you're going to push and hold for 5 counts, and then relax, and then push again, and hold for 5 counts, and relax. And you repeat that 3 times. Then what you're going to do is you're going to make the legs slightly smaller, and she's going to push against smalling hands, and she's going to do it again 5 times, repeating 3 times. And what this does is we're using the muscles in the adductors and your buttock area to pull the joint back into alignment. So what you'll find is that if they've got the weakness going on there, she will struggle to do the exercise. Put it on the car, feet together with the last one, and she must squeeze as hard as possible. And I can feel that there is the right hip is quite weak now. I know that's the Trendelenburg hip, so she's actually got weakness in that leg as well. But she's got to try and knap it as hard as she can to try and realign the exercises. So she can use this as an exercise at home to help loosen that up. And then if we get her to hop off again, and we have a look, see how that is. Okay, we get her to bend forward again, and there the right one's starting to move. Come back up again, but she is still swiveling to the left. I mean the left side is lifting up. Go lift up this bum for me, the leg. Okay, good mooi. All right, and other leg. So as simple as that, the SI joint is now moving better. It's bending forward when she goes forward, and she's able to now stand on this leg. And we now need to strengthen the buttocks up so that we can get the crossover effect. So we'll do the lats and the buttocks together, doing a Superman exercise, which I'll show her how to do when we're done. She will do the bridging exercise to strengthen up the bum too, because she's got to work on this buttock here for the glute weakness over here. And that might also help the circulation that she's got going on down here. So that's how you treat an SI joint. It's very, very effective. The SI joints happen with falls and in pregnancies. So if you have any of those complications, that the patient is coming in complaining about those things happening and then feeling the instability. They will also, when they go down onto the floor, swivel their body. So if I'm down here, the people will swivel sideways like that to stand up if they've got a SI joint problem. So watch what they are doing. She did have the swivel when she stood, and it's a very simple fix, because you already see now just from what we've done, a couple of minutes and her SI joint's feeling much better. If you do it with a lady that's had a pregnancy and you realign it after the birth that's taken place, because it usually happens during the pregnancy when they're heavily pregnant because the ligaments have become lax, and you do it then after the pregnancy to realign their joint, and then they won't have problems, because sometimes the pain is so debilitating, it wakes them, they can't sit, they can't stand, they can't walk, it's too painful. Now that's a quick fix, and it's easy to do, and patients can do it at home on their own. So thanks for watching. If you know anyone that's got back pain that's been struggling since they were pregnant, or they've had a nasty fall, please send them the link so that they can start doing the exercises to improve their function. Thank you for being our model, and we look forward to your questions that are coming up. If you've got anything that you want to ask, please send the questions so that we can make more videos for you to learn and understand. Thanks for watching. Bye.